I'm Leonardo Paiva. Preventable medication errors send over 1.3 million people to the ER every year, and the information to stop most of them already exists inside FDA drug labels. MedGuard puts it to work. A doctor can't read every label every time, and today's alerts fire so often that clinicians ignore over 90% of them because they never explain their reasoning for that specific patient. It's not a knowledge problem, it's getting the right evidence for the right patient at the right moment. MedGuard is a multi agent system that acts like a digital clinical pharmacist. Submit a patient's history and proposed medications, and it returns a safety verdict for every drug, each backed by the actual FDA label text, not a generic alert. Watch it run. The agent writes its own queries against our FDA label database in Elasticsearch, pulls the live warning text, and reasons over it against this patient's profile with Gemini. Here's the payoff. The report opens with the full picture: a 32-year-old woman with community acquired pneumonia, fever, productive cough, sharp right sided chest pain. Her vitals and labs captured automatically. Two drugs were proposed. The amoxicillin clavulanate comes back approved, standard of care for pneumonia, with the FDA reference dosage pulled straight from the label. But the dipyrone, given for her fever, comes back contraindicated, and MedGuard shows you why in the FDA's own words. Dipyrone was banned and withdrawn from the US market in 1977 for its link to severe, fatal agranulocytosis, a collapse of the white blood cells this patient needs to fight her infection. This isn't a rule firing. The agent read the label, matched it to this patient, and surfaced the exact warning, then recommended safe alternatives like acetaminophen or ibuprofen. One screen, every verdict grounded in real FDA evidence. MedGuard shows runs on TypeScript and Google's Agent SDK, connecting Gemini to Elasticsearch through the MCP protocol. And Elastic isn't a supporting tool here, it's the foundation. The agent has no hard coded drug knowledge. Everything it knows comes from querying the index in real time. Our FDA Drug Labels Index holds a complete FDA label dataset, contraindications, warnings, and precautions. For each proposed drug, the agent writes a targeted query in Elasticsearch's own query language, ESQL, through Elastic's MCP toolbox, and retrieves the live